Alcohol use disorder represents one of the most prevalent and devastating mental health conditions worldwide, affecting approximately 14.5 million adults in the United States alone and millions more globally. Despite alcohol's widespread social acceptance and legal status in most countries, alcohol use disorder is a serious medical condition that can have profound consequences on an individual's physical health, mental well-being, relationships, and overall quality of life. This chronic brain disorder is characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. The transition from social drinking to alcohol use disorder is often gradual and insidious, making it difficult for individuals and their loved ones to recognize when casual consumption has evolved into a clinical condition requiring professional intervention. Unlike the stereotypical image of alcoholism portrayed in media, alcohol use disorder affects people from all walks of life, including successful professionals, parents, students, and elderly individuals. The disorder exists on a spectrum from mild to severe, with varying degrees of impairment and different treatment needs. Understanding alcohol use disorder as a legitimate medical condition rather than a moral failing or character weakness is crucial for reducing stigma and encouraging individuals to seek the help they need. Understanding alcohol's effects on the brain. Alcohol's impact on the brain is both immediate and long-lasting, affecting multiple neurotransmitter systems and brain regions responsible for decision-making, impulse control, and reward processing. When alcohol is consumed, it rapidly crosses the blood-brain barrier and begins altering brain chemistry within minutes. Initially, alcohol enhances the activity of gamma-aminobutyric acid, or GABA, the brain's primary inhibitory neurotransmitter, which produces the relaxing and sedating effects associated with drinking. Simultaneously, alcohol triggers the release of dopamine in the brain's reward center, creating feelings of pleasure and reinforcement that encourage continued use. With repeated exposure to alcohol, the brain undergoes significant neuroadaptation in an attempt to maintain normal function despite the presence of this foreign substance. The brain begins producing less natural GABA and reduces the sensitivity of GABA receptors, leading to tolerance where increasingly larger amounts of alcohol are needed to achieve the same effects. This adaptation also explains why individuals with alcohol use disorder experience anxiety, restlessness, and difficulty sleeping when they're not drinking, as their brain has become dependent on alcohol to maintain normal neurotransmitter balance. Chronic alcohol use also affects the prefrontal cortex, the brain region responsible for executive functions such as planning, decision-making, and impulse control. This damage helps explain why individuals with alcohol use disorder often continue drinking despite clearly understanding the negative consequences of their behavior. The hippocampus, crucial for memory formation, is also significantly impacted, leading to the blackouts and memory problems commonly associated with heavy drinking. These neurobiological changes underscore why alcohol use disorder is considered a brain disease rather than simply a behavioral choice. Clinical features and diagnostic criteria. The diagnosis of alcohol use disorder is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, which evaluates patterns of alcohol use leading to clinically significant impairment or distress. The diagnostic criteria are organized around four main domains: impaired control, social impairment, risky use, and pharmacological criteria including tolerance and withdrawal. These criteria help clinicians assess the severity of the disorder and develop appropriate treatment plans. Impaired control manifests in several ways, including drinking larger amounts or for longer periods than intended, persistent desire or unsuccessful efforts to cut down or control drinking, spending considerable time obtaining alcohol or recovering from its effects, and experiencing strong cravings or urges to drink. Many individuals with alcohol use disorder describe feeling as though they've lost control over their drinking, despite genuine intentions to moderate or stop their consumption. Social impairment becomes evident when alcohol use results in failure to fulfill major role obligations at work, school, or home. This might include missing work due to hangovers, neglecting family responsibilities, or performing poorly in academic settings. Individuals often continue drinking despite persistent social or interpersonal problems caused or exacerbated by alcohol use, such as arguments with family members, loss of friendships, or marital conflicts. The progression of alcohol use disorder frequently involves giving up or reducing important social, occupational, or recreational activities in favor of drinking or recovering from drinking episodes. Physical and mental health consequences. The physical health consequences of alcohol use disorder are extensive and can affect virtually every organ system in the body. The liver bears the brunt of alcohol's toxic effects, as it's responsible for metabolizing approximately 95% of consumed alcohol. Chronic heavy drinking can lead to fatty liver disease, alcoholic hepatitis, cirrhosis, and ultimately liver failure. These conditions develop progressively, often without obvious symptoms until significant damage has occurred, making regular medical monitoring crucial for individuals with alcohol use disorder. Cardiovascular complications from chronic alcohol use include hypertension, cardiomyopathy, arrhythmias, and increased risk of stroke. While moderate alcohol consumption has been associated with some cardiovascular benefits, heavy drinking significantly increases the risk of heart disease and sudden cardiac death. The relationship between alcohol and cancer is particularly concerning, with chronic alcohol use increasing the risk of developing cancers of the mouth, throat, esophagus, liver, breast, and colorectal. Even moderate drinking has been associated with increased cancer risk, particularly breast cancer in women. Neurological complications extend beyond the addiction-related brain changes to include peripheral neuropathy, causing numbness and pain in the hands and feet, and Wernicke-Korsakoff syndrome, a serious brain disorder caused by thiamine deficiency that can result in permanent memory problems and cognitive impairment. Chronic alcohol use also significantly impacts the immune system, making individuals more susceptible to infections and reducing the body's ability to heal from injuries. The mental health consequences of alcohol use disorder are equally serious and often overlooked. Depression and anxiety disorders commonly co-occur with alcohol use disorder, creating a complex relationship where alcohol may initially be used to self-medicate emotional distress, but ultimately exacerbates these conditions. Sleep disturbances are nearly universal among individuals with alcohol use disorder, as alcohol disrupts normal sleep architecture and can lead to chronic insomnia even during periods of sobriety. Risk factors and development. The development of alcohol use disorder results from a complex interplay of genetic, environmental, psychological, and social factors that vary significantly among individuals. Genetic factors play a substantial role, accounting for approximately 50 to 60% of the risk for developing alcohol use disorder. Family history of alcoholism is one of the strongest predictors, with children of parents with alcohol use disorder being 3 to 4 times more likely to develop the condition themselves. Specific genetic variations affect how individuals metabolize alcohol, their sensitivity to its effects, and their vulnerability to developing dependence. Environmental factors during childhood and adolescence significantly influence alcohol use disorder risk. Adverse childhood experiences, including physical or sexual abuse, neglect, household dysfunction, and exposure to domestic violence, substantially increase the likelihood of developing alcohol problems later in life. These experiences often lead to the use of alcohol as a coping mechanism for emotional distress, trauma symptoms, and difficulty regulating emotions. Cultural and social factors also play important roles, with certain cultures having higher rates of alcohol use disorder due to drinking patterns, social norms, and availability of alcohol. Psychological factors that increase risk include personality traits such as impulsivity, sensation-seeking, and difficulty tolerating distress. Mental health conditions, particularly depression, anxiety disorders, bipolar disorder, and post-traumatic stress disorder, significantly increase the risk of developing alcohol use disorder. The age at which individuals first begin drinking is also crucial, with earlier initiation associated with higher risk of developing alcohol use disorder. This is particularly concerning given that the adolescent brain is still developing, making it more vulnerable to the effects of alcohol and more likely to develop addictive patterns of use. Treatment approaches and recovery. Treatment for alcohol use disorder has evolved significantly over the past several decades, moving from a one-size-fits-all approach to personalized treatment plans that address the unique needs and circumstances of each individual. The foundation of effective treatment typically involves a combination of behavioral therapies, medical management, and psychosocial support services. The recognition that alcohol use disorder is a chronic medical condition has led to treatment models that emphasize long-term management and recovery support rather than expecting permanent abstinence after a single treatment episode. Behavioral therapies form the cornerstone of alcohol use disorder treatment, with several evidence-based approaches showing significant effectiveness. Cognitive behavioral therapy helps individuals identify triggers for drinking, develop healthy coping strategies, and change thought patterns that contribute to alcohol use. Motivational interviewing is particularly effective in the early stages of treatment, helping individuals resolve ambivalence about changing their drinking behavior and building motivation for recovery. Family therapy and couples therapy can be crucial components, as alcohol use disorder affects entire family systems and family support significantly improves treatment outcomes. Medication-assisted treatment has become an increasingly important component of comprehensive care for alcohol use disorder. 3 medications are currently approved by the FDA for treating alcohol use disorder: naltrexone, acamprosate, and disulfiram. Naltrexone works by blocking opioid receptors in the brain, reducing the rewarding effects of alcohol and decreasing cravings. Acamprosate helps restore normal brain chemistry in individuals who have stopped drinking, reducing withdrawal symptoms and cravings. Disulfiram creates unpleasant physical reactions when alcohol is consumed, serving as a deterrent to drinking. These medications are most effective when combined with behavioral therapy and psychosocial support. The detoxification process for individuals with severe alcohol use disorder requires careful medical supervision, as alcohol withdrawal can be dangerous and potentially life-threatening. Withdrawal symptoms can range from mild anxiety and tremors to severe complications including seizures and delirium tremens. Medical detoxification typically involves gradually tapering alcohol use or using medications to safely manage withdrawal symptoms while preventing serious complications.